German Chancellor Angela Merkel is warning that up to 70% of the German population is likely to contract the coronavirus. As Germany reported its third death from the disease, Merkel said the country must do everything it could to slow the virus's spread and prevent the healthcare system from being overwhelmed. She called on people to show solidarity with the elderly and those with underlying illnesses who are most likely to die if they become infected. Merkel said efforts were also being made at the European Union level to contain the disease and stop the economic fallout.
Being aware of this fact and aware of the fact that there are vulnerable groups of the population, people with existing illnesses, older people who can have a more serious case of this virus if they catch it, means that our approach has to be defined by ensuring that our health system not be overwhelmed, but rather that we have to be able to deal with the options we have in the healthcare system to ensure that we slow down the spread of this disease. And this is why all of the measures that we're putting into place are crucial, because they gain us time.
All right, let's talk now about the outbreak here and Germany's response. We have Derek Williams from DW Science with us here in our studio, and we have our chief political editor, Michaela Küffner, also with us. Good to have you both. Michaela, let's start with you. What were the main takeaways from Chancellor Merkel's conference?
Well, first of all, that she herself mapped out really the extent of this crisis and how serious the situation is, calling on solidarity here in Germany, also stressing that there should be a European response. She reported from a conference call that there had been between the EU member states on how to respond, some 25 billion euros potentially on the table there. And most strikingly, she was pretty much word by word echoing the expert advice she's receiving with the scientists sitting there in that press conference as well, warning everyone that this crisis is only just beginning, but also calling on the responsibility of local authorities and every individual there.
And Michaela, just to make clear, she didn't announce any new measures, did she?
Well, officially, what she did say is that there would be a meeting with business leaders this Friday to put new measures in place. But there was no new state of affairs, both in terms of the recommendation by the German health minister, who again echoed scientists by recommending that not more than 1,000 people should be in a room at any given event, and calling on the responsibility of regional authorities to decide whether a football match, for instance, should go ahead. That pretty much, I think, is off the table nationwide here in Germany right now. And also she stressed that this was a test for society, and she hopes that it will pass it.
All right, those are the measures in place. Derek, is this the right way to tackle the coronavirus outbreak here in Germany?
Well, I think the right way, it's probably the only way at this particular point. I mean, when you're looking at 60 to 70% of the population eventually contracting this infection, the only thing that you can do, and this was repeated over and over in the press conference, is to slow it down. And the main reason that you want to slow it down is because you want to give the health system time to absorb that number of people. And that was the first message that came across. The second message that was repeated over and over again is Germany is really going to has to try to protect its most vulnerable. That includes the elderly. We know that the coronavirus when it infects the elderly, has a much higher mortality rate than it does with younger people, and also people who are chronically ill.
Slowing it down also gives researchers an opportunity to work on that vaccine that was also mentioned. Derek, as this outbreak spreads and people are increasingly worried, what is the most important thing to keep in mind here on this outbreak?
Well, there are a couple of things that you can't really say too often. I've said them over and over again. Go to the WHO website, look at the 4 or 5 things that you can do personally yourself to help prevent the spread of the coronavirus. They're very, very simple things that include washing your hands and practicing proper coughing etiquette or sneezing etiquette. Very, very simple things. And the other thing that is very important that you can't say too often is that 4 out of 5 people, so around 80% of the people that contract this virus are not going to end up hospitalized. They're going to have mild symptoms, or they're going to have maybe even be asymptomatic. And so it's important not to panic at this point. It's important to remember that if you get the virus, it's not the end of the world. The chances are you're going to feel it as you would possibly like a flu or even just a bad cold, and you're going to come through it. And afterwards, the good news is that you'll then have immunity from it.
All right, those are the important things to keep in mind there. Michele, just quickly coming back to you, we've been talking about the outbreak and approach here in Germany. Can you tell us what the Chancellor said about what's being done on the European level?
Well, she said that Europe would want to act together. Then she got a specific question from an Italian journalist, which was rather interesting, asking what that solidarity could mean in concrete terms, whether Germany would send doctors, would send supplies. And the response from Angela Merkel was that this indeed was a stress test for all health systems, and that Germany would look into what it can responsibly do. So it's a very interesting moment in time here, with so many European states not knowing yet how big the force will be with which this virus will hit the own health systems. But what is clear is that money will be on the table, that there will be a lot of compensation for businesses across the European Union, but there were still at the beginning of what is clearly a political learning curve for politicians and for all of us as society.
Our chief political editor, Michele Küffner, and Derek Williams with us here in studio. Thank you both very much. Well, as we have heard, Italy is the worst-hit country in Europe. The leader of the northern region around Milan has called for stricter measures to be imposed to halt the virus. That appeal coming from Attilio Fontana, as the number of dead increased to 631 and infections exceeded 10,000. Fontana is calling for public transport in the north to be completely suspended. Italy is in the second day of a nationwide lockdown.
Rome on lockdown. Its streets unobscured by the usual hordes of tourists. The shutters came down at 6 p.m. as bars and restaurants closed in accordance with new measures to stop the spread of the coronavirus. The message is simple: stay at home. It's advice Italians are taking seriously after the number of confirmed cases of COVID-19 topped 10,000 and the death toll rose above 600. In Florence too, the normally bustling streets were unusually quiet. And for some, the financial consequences of the nationwide lockdown are already beginning to bite.
From around 140 plates a day, we've gone down to 25 plates this afternoon. We've decided to stay open to see if we can do something, even if it's a small thing. We have employees and rent to pay, and a loan.
Meanwhile, there's trouble with the neighbours. Slovenia has closed its border to Italy, while Austria has banned incoming journeys by train and plane. Moves criticised by French President Emmanuel Macron.
We don't want things to get out of proportion. Why? Because it needs to work, and because it's only the beginning of this epidemic. And if we take disproportionate measures, they'll be unsustainable in the long run, and that's counterproductive. I sincerely believe that these are bad decisions. European coordination is much more efficient.
For David Sassoli, European coordination means working from home. The Brussels-based president of the European Parliament is in self-isolation after a visit to his native Italy. Back in Rome, the president of the Italian Football Federation said that the season, already suspended, could be abandoned as the coronavirus affects every pillar of Italian life.
Okay, let's look now at some other coronavirus developments around the world. There is good news from China, which has officially reported its lowest number of infections since the outbreak started there. In Wuhan, the epicenter of the outbreak, workers in key sectors are due to go back to work. But elsewhere, infection rates are still increasing. In the U.S., there are now more than 1,000 confirmed cases. The National Guard has been deployed to a New York suburb that's been quarantined. Greece is shutting schools, universities, and daycare centers for 2 weeks. And in the UK, a health minister has announced that she has tested positive for the virus.
Well, it was widely reported on Tuesday that South Korea's outbreak was waning, but now a new cluster of infections stemming from a call center in the capital, Seoul, is causing concern. So far, 93 people have tested positive among the center's employees and their families. Before that news, correspondent Frank Smith sent us this report from Seoul on how paramedics are dealing with the suspected cases.
Paramedics in South Korea are answering some tough calls in battling the coronavirus. For each prospective COVID-19 emergency, like this one, they take time to put on high-level protective gear, and only one paramedic attends to possible patients to safeguard the team. Paramedic Ko Myung-kwon is ready for what comes, watching for the telltale symptoms of coronavirus: high fever and coughing.
COVID-19 calls are difficult to respond to because we still don't have a clear idea of how to distinguish an actual case from a false alarm. Even if a person hasn't traveled overseas but is running a fever, we still have to assume the worst because there's an outbreak in the community.
3 hospitals in Seoul have suffered clusters of the outbreak, closing their emergency rooms. Other hospitals are at times unavailable because they're overcrowded. When transporting possible coronavirus patients, ambulances in Seoul sometimes travel long distances. South Korea's CDC and Emergency Command Center route paramedics to designated hospitals with space in triage and a negative pressure isolation room, which has special ventilation to prevent the spread of the virus. After each call, the ambulances are thoroughly disinfected and their interiors sealed to ensure they're virus-free.
If I ever get infected, I'm confident that I would eventually recover, given my young age. But I live with my parents, and they are older, so I'm most worried that I might pass it on to them. And there are no guarantees that they could receive the treatment they need in a timely manner, because emergency services are so overstretched right now.
The medics at the ambulance center are required to live in isolation, eating alone at separate times and maintaining social distancing. Still, team members say that morale has remained good.
We work in a field that values teamwork above all else, so pulling in an extra shift and going out on another call is simply a part of our job description. If they needed us to put in more hours, we simply kept our head down and worked hard instead of fretting about it.
It looks like there will be no let-up in work. Ko Myung-kwon has just been dispatched for a week with more than a dozen colleagues to Daegu, the epicenter of South Korea's coronavirus outbreak.
And Frank Smith, who filed that report, joins us now from Seoul. Frank, first of all, how bad is the coronavirus outbreak in South Korea?
Well, today the total was nearing 8,000 cases here in South Korea. But what's changed over the last 2 days is an outbreak here in the capital, which has remained largely isolated from the big part of the outbreak down in Daegu, as I mentioned. Just 93 new cases were announced just in the last day. That brings the total here in the South Korean capital to 150. That took place at a call center at a subway junction where 2 subways lines intersect. And so there are concerns that the cluster, a new cluster, could develop here in the capital.
Is this new spike in reported infections, Frank, a sign that containment efforts are failing?
Well, I'm not sure about that. One of the things about this new cluster is that 2 of the people that were working in that call center that tested positive were members of Shinjonji. That's the cult at which one so-called Patients 31 spread the virus to many people and sort of initiated that outbreak in Daegu, which now includes more than 60% of those in South Korea. It's unclear whether those 2 Shinjonji members at the call center initiated the outbreak here in Seoul. So whether or not the containment is succeeding, I think we have to compare where we would be if the government wasn't engaged in the intense PR campaign to see people wash their hands more, wear masks, and stay indoors more and refrain from large public gatherings.
South Korea is a major industrial power in Asia. What impact is the coronavirus outbreak having on the economy there?
Well, I'd like to refer very specifically to a story I was told today. A business person that I know was trying to contact his accountant. He couldn't get a hold of him all day yesterday. And finally, he got a call back from his accountant late in the day and asked, why were you so busy all day today? And the accountant answered, I was answering calls from business people about how they can lay off employees that are regular workers that have, some tenure, some experience and some seniority, because the intensity of this outbreak is having a serious effect on businesses, not just small markets, but also large businesses.
Frank, thank you very much. That was reporter Frank Smith in Seoul.